At the Infant Language Research Lab at Johns Hopkins University, the beginnings of language are investigated using 3 procedures. Each is designed to explore specific types of processes at different stages of development. A challenge in studying any aspect of cognition during infancy is finding a way to elicit responses from the infant that will indicate something meaningful about their perceptual and cognitive competencies. As you will see, the procedures are carefully constructed to utilize simple behaviors that infants naturally exhibit during the first year of life, namely sucking and looking.
The high-amplitude sucking procedure is a procedure that we've used for now almost 30 years. It's used with very young babies, and it was one of the first methods that scientists had to try to find out what babies perceive with respect to speech sounds and other kinds of visual stimuli. In our experiments, we use this procedure to examine what differences babies can tell between speech sounds. And much more recently, what we've been looking at is how babies begin to attend to different information in speech sounds and what kind of information that they remember. What we do is we put the pacifier right here in the baby's mouth, and the pacifier is hooked up to a pressure transducer, which gives us an output of the baby's sucking responses. We can tell how hard the baby is sucking on the pacifier.
But every baby sucks with a different amount of pressure, which is assessed using a polygraph machine in the observation room. Here, the researcher adjusts the sensitivity of the machine to tailor it to each infant's baseline sucking intensity and frequency. With this adjustment, the machine registers each suck while letting other mouth movements pass undetected.
Once the baby has established a sucking rate, we start to introduce a speech sound. Kibad, sabad, sabad, wibad, kibad, wibad, wibad. But we play that speech sound every time the baby gives a hard suck on the pacifier. It usually takes infants only 2 or 3 minutes to figure out what is going on in the experiment. And once they have established that they're turning on the speech sounds, they begin to suck on the pacifier more and more often, and the sounds come on more and more frequently. Now, as you can imagine, after about 2 or 3, 4 or 5 minutes of this, babies get a little bit bored with what they're hearing, and their sucking rate begins to decline. And when it declines to a predetermined criterion, then what we do is we introduce a new period or new phase into our experiment.
Researchers can either continue to play the same sounds, and those infants would provide information on how they respond to unchanging stimuli, in effect creating a control group, or for other infants, new sounds can be introduced. Now, even 2-month-olds like novelty, so it's expected that if babies perceive the difference in the sounds, the sucking rate will increase, and it usually does.
In order to tell if babies actually remember the information that they're hearing, we usually introduce a short 2-minute period in which we play no sounds whatsoever, but instead the baby gets to watch a series of colorful slides. Then we pick up with playing the speech sounds over again, and if the baby remembers what he or she heard during the first part of the experiment, then we expect that when we change the sounds, they'll react to that kind of change, and they'll begin to suck at a higher rate.
All pacifiers are new and sterilized. They are held by an assistant who wears headphones playing masking music, keeping him or her blind to the condition of the infant. And parents are able to observe the entire procedure by watching their child's reflection in a mirror.
The kinds of things that we study using the high-amplitude sucking procedure really have to do with basic capacities that all infants have to learn any language.
T is for top. It spins on its tip.
And indeed, it has been shown that babies have a lot of capabilities within the first 2 or 3 months of age. But these abilities are universal in the sense that we expect to find them in infants from any culture. What happens, though, is that around 5 or 6 months of age, babies begin to learn more about the particulars of their own native language.
Do you see a monkey.
and in this area that would be English for most families, then we can start to ask different kinds of questions about what they're learning about their native language. Now, because the high-amplitude sucking procedure only works with infants that are about 2 or 3 months of age, we have to use other kinds of procedures to be able to ask these kinds of questions about what babies are learning about their native language.
The head-turn preference procedure provides an indication of how interesting different speech stimuli are to infants. Interest is measured by recording the amount of time infants attend to the stimuli presented behind a flashing light. By comparing infants' preference among 2 or more stimulus types, researchers can determine if infants are sensitive to the relevant properties that differentiate the stimuli.
How the procedure works is that the parent and the infant come into this room and they sit on a chair here in the middle of the room with the infant on the lap and looking towards the green light. There's an experimenter in back who watches where the infant is looking.
Both the researcher and the parent wear sound-insulating headphones playing masking music so they are blind to the experimental condition.
The experimenter begins each trial by flashing the green light. When the infant looks towards the green light and the experimenter sees that the infant is focused towards the center, then pushes another button and one of the red lights begins flashing. Once the infant looks towards that red light, then the experimenter pushes another button and speech begins to play from a speaker that's located behind this red light.
Doctor, doctor, doctor.
Now, the speech stimulus will continue to play until the infant gets bored and looks away from the speech stimulus, so we can get an idea of how interested the infant is in each particular kind of sentence or word that we play.
The amount of time the infant is oriented toward the speech stimulus is recorded for each trial, and the average orientation time over the trials is calculated for each stimulus type.
What turns out to be the case is that infants will pay more attention to a word or a sentence or a paragraph if they notice something familiar in the paragraph. So if they were familiarized with one word, then they will pay attention to that word if it occurs in the sentences. So if they were familiarized with doctor, then they will pay more attention to a sentence that contains doctor than a sentence that contains something else.
He is much younger than the old doctor. I think your doctor is better.
Researchers can also investigate how long infants remember words. If an infant is familiarized with one word on one day, can she return the next day and still recognize that same word in a sentence?
It's questions like this that allow us to get an idea of how much of the word learning process infants are already mastering before the first year of life.
This procedure is not used with infants younger than about 4 months because it requires that they can turn their heads toward the lights. However, it has been used successfully with infants as old as 24 months, allowing researchers to explore infants' sensitivity to more advanced aspects of language, such as the positioning of grammatical constituents in sentences. For example, when do infants begin to detect relations between auxiliaries such as is or can and main verbs? Infants are presented with sentences in which an auxiliary like is followed by a verb with the correct ing ending versus sentences in which the wrong ending occurs after an auxiliary like can. A computer-generated voice ensures that both types of sentences are produced with the same acoustic characteristics so that any listening differences are attributed to their sensitivity to their grammatical forms. Though the high-amplitude sucking and head-turn preference procedures allow researchers to explore infant sensitivities to speech sounds and their knowledge of how those sounds are organized in the ambient language, they do not test, by design, what infants might know about word or sentence meaning. This third tool for investigating language development, the preferential looking procedure, examines infants' understanding of word meanings. At what age do infants begin to learn that words label objects in the world?
Is that a doggy? What does it say, please?
Please.
Thank you.
It's an exciting time for parents when their infant first starts to say his or her first words. But even before that, it can be exciting to learn that your infant is actually able to comprehend some of the words that he or she hears.
Can you get his tail? Can you get his tail? See the wiggly tail?
We use this preferential looking procedure to determine at what age infants are able to understand that the words they hear refer to the objects and actions in their environment. More specifically, we're interested in what this comprehension actually consists of. The infant sits on his or her parent's lap and views two videos while listening to a voice that's saying words that matches one of the videos. Based on the infant's looking patterns, we're able to determine if the infant can understand the association between the words and the objects. For example, in an experiment that we're currently doing, the infants view videos of their mothers and fathers and listen to the words mommy or daddy.
These videos are recorded prior to the experiment. During the procedure, the infant is presented with two objects simultaneously, in this case, the mother and the father. The parent wears a visor with an attached piece of thick black felt to block any view of the monitors so as not to lead the infant. The researcher sits out of sight behind the monitors and controls the onset of each trial. When the infant looks at a blinking orange light, the trial is initiated. The researcher turns off the light and manually raises an opaque screen, revealing the video playback of each parent. Before the infant sees the monitors, he or she is presented with a word, for instance, mommy, that is repeated throughout the trial from a loudspeaker. The amount of time the infant looks to each object is coded using a video taken of the infant during the procedure. In this case, the investigators analyze the data to see if the infant will look longer at their mother when they hear mommy and longer at their father when they hear daddy. Recent findings suggest that by 6 months, they do. Many more issues in language development have been and will be explored using these three investigative techniques. 30 years ago, investigators could not probe children's language capacities until they were able to speak. But now, with procedures like the ones described here, researchers can investigate language comprehension in infants long before they utter their first word.